we have no way of tracking the long-term health care of these people. An example, a nurse was shot in the operating room. His knee was blown across the room. And this is a story of tragedy which amplifies the war crimes committed by the IDF, but it also is pursuant to the point that we're making now about long-term health care. So this is a tax-paying, productive, highly skilled member of the Gazan society, helping other Gazans who are injured. He's closing a wound in the operating room. During that closure, an Israeli soldier, I believe it was the Kuwaiti hospital, but I could be wrong, and it is an IDF soldier comes in and orders him to leave the patient who's still asleep on the table. He refuses to. The nurse gets his knee shot and his tibia bone, the bone right below the knee, the bottom half of the knee, gets blown across the operating room. He's missing this much of his shin bone by the knee. He gets operated on that day himself to save his life and to save his leg. They fill the defect with medical plastic, cement. His wounds can't be closed because he's missing a bunch of skin. He's admitted to the hospital, of course. The next day, the Israeli soldiers come and arrest him. They take him to Israel in a prison, blindfolded and handcuffed. He remained blindfolded and handcuffed for 45 days, fed a juice box every day, sometimes every other day, no solid food, zero wound care, with a gaping open wound. He then gets dropped off at the border naked on the 45th day because they do their investigation, I suspect, but clearly he's not Hamas because they never would have let him go, right? So he crawls for 3 kilometers, blinded in one eye because there's a going away present. He gets a rifle butt in his right eye. It explodes in his head, right? His eye liquids are dripping down his face. He crawls in the dirt. Somebody finds him naked, brings him to our hospital.